Have you ever wondered if a simple symptom could be a warning sign of something more serious? In the hustle and bustle of our daily lives, it's easy to overlook or dismiss minor health issues. But what if these seemingly insignificant symptoms are your body's way of alerting you to a bigger problem such as cancer? Cancer can be a daunting word, but early detection is key to successful treatment. This is why it is crucial to be aware of the subtle signs your body may be giving you. In this video, we're going to discuss some common yet often overlooked symptoms of various types of cancer. From unexplained weight loss to persistent fatigue, unusual skin changes to changes in bowel or bladder habits, persistent pain to difficulty swallowing, unexplained bleeding to lumps and bumps. All these symptoms could be potential red flags. Knowledge is power, and being informed could save your life. Stay tuned as we delve into specific symptoms that should never be ignored. Imagine losing weight without trying. Sounds ideal, right? Not necessarily. Unexplained weight loss is often brushed off as a happy coincidence, but it can actually be a sign of something far more serious. It's commonly seen as an early symptom of various cancers, including pancreatic, stomach, esophageal, and lung cancer. But what do we mean by unexplained weight loss? It's when you're shedding pounds without making any deliberate changes to your diet or exercise routine. It's when your jeans start to sag, your belts need tightening, and you're not doing anything differently. This isn't about a pound or two fluctuation, which is pretty normal for most of us. We're talking about losing 10 or more pounds unexpectedly. If this sounds familiar, it's important not to panic, but it's equally important not to ignore it. If your scale is dropping numbers and you're not sure why, it might be time to check in with your doctor. Feeling tired after a long day is normal, but what if the fatigue never goes away? Imagine waking up as tired as when you went to bed day after day. This isn't just about poor sleep or a packed schedule. We're talking about a profound, persistent fatigue that doesn't improve with rest and can significantly impair daily activities. This type of fatigue is a common yet often ignored symptom of certain cancers, including leukemia as well as colon and stomach cancers. But how do you tell it apart from the usual tiredness? Well, normal fatigue usually resolves with rest, hydration, and a good night's sleep. Cancer-related fatigue, on the other hand, is relentless. It drags on, making you feel physically and emotionally drained, and it doesn't get better with rest. If you find yourself constantly exhausted without a clear reason, it's not just the rigors of modern life weighing you down. It might be your body signaling something more serious. Remember, perpetual exhaustion is not a trophy of a busy life. It could be a cue from your body that something's off. Your skin can tell you a lot about your health. Are you paying attention to its signals? Think of your skin as a canvas reflecting the stories of your body. One critical narrative it might be unfolding is that of melanoma, a serious form of skin cancer. It often begins as just a new mole or a change in an existing one. Are these moles asymmetrical? Do their borders seem irregular or their colors varied? These could be warning signs. But melanoma isn't the only concern. Other changes to watch for include unexpected bleeding or sores that don't heal, excessive scaling, or new patches of skin that feel significantly different. Each of these could hint at skin cancer. While a new scaly patch might just seem like a dry spot, it's essential not to dismiss it too quickly. Skin, the body's largest organ, is also its sentinel. Changes in its texture, color, or general appearance can be early indicators of deeper health issues. Keep an eye on your skin. It might just be the first to alert you to danger. Is your bathroom routine suddenly inconsistent? It's easy to dismiss changes in bowel or bladder habits as merely dietary effects or stress, but did you know these changes can be early indicators of something more serious, such as cancer? When we talk about bowel habits, chronic diarrhea or constipation can be alarming. While everyone has occasional irregularities, persistent changes should not be ignored. These symptoms might indicate colon cancer, particularly if they come without an obvious cause. Moving to bladder habits, if you find yourself needing to urinate more frequently or notice blood in your urine, these could be signs pointing towards bladder or prostate cancer. It's not just about the frequency, but also the urgency and discomfort that accompany these changes. Understanding these signs is crucial. They are your body's way of telling you that something might be wrong. Ignoring them could delay a diagnosis of potentially treatable conditions. These changes, especially if persistent, should prompt a visit to your healthcare provider. Pain is the body's way of signaling that something is wrong. Are you listening? When discomfort stretches beyond the ordinary, lingering longer than the usual healing time, it might be more than just a simple annoyance. Persistent pain, a pain that doesn't seem to go away despite time and basic remedies, can be an early warning sign of something more severe, such as cancer. For instance, a dull ache in the bones could be a whisper from bone cancer. Similarly, a continuous, unusual pain in the lower abdomen might be ovarian cancer making its presence known. Testicular cancer, too, might announce itself through a persistent ache or discomfort in the lower groin area. Understanding where the pain is and how it behaves can provide crucial clues. Is it sharp or dull? Is it localized or spreading? These questions are key in deciphering the message your body is trying to send. So when faced with persistent pain that defies explanation, consider it a red flag. Consult a health professional to delve deeper into the cause. Don't dismiss persistent pain as just another ache. It could be a critical signal. Ever had trouble swallowing your food? It's a common enough experience, perhaps after eating too quickly. However, when this difficulty becomes persistent or worsens over time, it could be signaling something more serious than a simple dining mishap. Difficulty swallowing, medically known as dysphagia, can be a sign of throat or esophageal cancer. These cancers can cause the passages to narrow, making it tough to swallow both solids and liquids. It might start with a feeling that food is stuck in your throat or chest, or you might even experience pain when swallowing. What's crucial here is the persistence of these symptoms. If what started as an occasional inconvenience progresses to a frequent struggle, it's a red flag. This symptom is particularly insidious because it's easy to dismiss. Many might opt for softer foods or liquids as a quick fix, but this only masks the issue. Remember, early detection can dramatically increase the effectiveness of treatment. Don't just switch to soups and shakes. If swallowing is tough, get it checked out. Bleeding that doesn't make sense needs immediate attention. Let's dive into unexplained bleeding, a symptom that can be easily overlooked but may signal something far more serious. Unexplained bleeding can come from any part of the body. This could manifest as blood in urine or stools, a persistent nosebleed, or even vaginal bleeding outside of the normal menstrual cycle. It's key to remember that unexplained is the operative word here. If there's no apparent reason for the bleeding, it's crucial not to dismiss it. This symptom can be particularly indicative of cancers such as those affecting the kidney or bladder. For instance, blood in the urine might be a sign of kidney cancer, while bladder cancer might present itself through painless bleeding. Internal bleeding might not always be visible but can manifest as unexplained bruises, patches, or spots under your skin. So, be vigilant and proactive about your health. Seeing unusual bleeding, it's not just a sign to be cautious, it's a sign to take action. Don't ignore these warning signs. Seek medical advice immediately. Not all lumps are harmless. Do you know which ones to worry about? When we talk about lumps and bumps, it's crucial to understand that not every new growth is a cause for panic. However, being vigilant about certain changes can be a lifesaver. Lumps can appear anywhere on the body, often in the breast, testicles, lymph nodes, and soft tissues. These could be benign, like cysts or lipomas, which are generally non-cancerous, but sometimes they signal something more serious. A key red flag is a lump that's hard, immovable, and painless. These characteristics can be concerning, especially if the lump is new or has changed in size, shape, or consistency. In the breasts, such changes demand immediate attention as they could signify breast cancer. Similarly, lumps in the testicles could be an early sign of testicular cancer, while swollen lymph nodes can suggest lymphomas. Remember, your body is constantly communicating with you. If you notice a new lump or an old one changes, don't wait. Talk to your doctor. Awareness is the first step towards action. As we've navigated through the often overlooked symptoms of cancer, the common thread among them all is the importance of listening to your body. Unexplained weight loss, persistent fatigue, unusual skin changes, changes in bowel or bladder habits, persistent pain, difficulty swallowing, unexplained bleeding, and of course those unexpected lumps and bumps. Each of these signs is your body's way of communicating that something may not be quite right. No symptom should be trivialized or ignored, and it's crucial to remember that early detection can make a world of difference. If you're experiencing any of these symptoms, it's important to consult with healthcare professionals as soon as possible. Our bodies are complex machines, and understanding their language can be a lifeline. Your body speaks. Make sure you're listening. Early detection saves lives. Take care and stay healthy.